Hi class, my name is Maya Gates and today I will be presenting on PTSD and rape victims. A little bit of a heavy topic, but it's important to have knowledge on it. First, let's start off with what PTSD is. PTSD is an acronym for post-traumatic stress disorder, which is a mental health condition that is triggered by a terrifying event, either by experiencing it or by witnessing it. Symptoms of PTSD after sexual assault. Survivors of the sexual assault react differently. People experience many symptoms after a person has been through a traumatic event, such as sexual assault. It is common among sexual assault victims, with some results indicating that about 70% of these victims have experienced crucial trauma levels. PTSD is a mental health condition and is not a sign of weakness. Therefore, it can be diagnosed and it can be treated. The survivors of these sexual assaults, everyone reacts differently. There are some people who have severe and chronic symptoms, and there are others who have, minimal to, no symptoms. These symptoms of PTSD can include intrusive symptoms, which is, unwanted and repeated memories of the event, flashbacks, and nightmares. An example of this is, let's say you're doing laundry and you're folding pants, and all of a sudden there's a flashback of, the incident that had happened out of nowhere. You're just folding your pants. Another symptom is avoidance, which is, staying away from reminders of trauma and emotional avoidance. Another symptom is changes in feelings and thoughts, which is distorted beliefs about yourself or others, never thinking that things are never going to get better and you're just going to stay the same, which is recurrent feelings of fear, anger, horror, guilt, hopelessness, and shame. Increased arousal, trouble staying or falling asleep, like 2 minute increments, not 2 minutes, 2 hour increments of sleep. Being easily fearful and or startled. The early disorders predicting PTSD after rape include dissociative and somatic form disorders, specific and agoraphobia phobias, depression, alcohol abuse, and gender identity disorders. Treatment of sexual assault survivors. For most survivors of sexual assault, symptoms subside after some time. However, there are symptoms for other survivors that subside longer or not subside, that have long-term effects, and they sometimes get worse. Treatment for this disorder have been found and have successfully suppressed the negative symptoms that have developed after the sexual assault had occurred. The sexual treatments include social learning and support on how to manage emotions, cognitive therapy, and prolonged exposure therapy. Traumatic impacts of the social assault experiences. The impact of the social assault depends on how long, the assault had lasted, the nature of the assault, and the extent of the physical harm. The impacts can include fear and anxiety, shock and anger, hypervigilance and hyperalertness, irritability and anger, nightmares and disrupted sleep, or emotional constriction. Go to my next slide. How sexual assault affects the brain. Fear of stalking, fear that a different individual will do similar acts. So, an example of this is going from one relationship where a person had done nothing but horrible things to you, and then going to another relationship with the same expectation that the person's going to do, horrible things to you. During traumatic acts, the brain does get overwhelmed and disorganized. You know, your body is connected with your brain. Your brain is what controls your body and your movements. And whenever something traumatic is happening, your body doesn't react, or it doesn't react fast enough. The brain often detaches or dissociates from reality in case of an overwhelming trauma, and you know, it will end up blocking the memory. So if the trauma is too traumatic, you know, it's too much, the brain will end up blocking it and will make it hard for you to recall any information or, you know, what had happened. The effects of lack of treatment after sexual assault will include stigma. You know, it could lead to homosexuality, rape and abuse as a result of stigma, substance abuse, or self-harm. Biological factors of PTSD include the dysfunctions of the brain structures, such as the hippocampus, which is what happens to the hippocampus is it'll shrink. You know, the hippocampus may physically be affected. Studies have shown that people who have suffered PTSD, the volume of their hippocampus may be smaller than others. Another dysfunction of the brain structure is the locus coeruleus. I think that's how you say it, which is what happens to this is the locus coeruleus is a major node, and it is a node in the stress response, and it integrates from multiple stress response circuits, and it can promote vigilance and anxiety. Another brain structure that can be affected is the noradrenatic system, which is norepinephrine, I think this is how you say it, that is released, and it is caused in part by activation of the area in the brain stem, also the amygdala. Biological response to trauma. Physiological responses include increased heartbeat. Adrenaline arouses the sympathetic nervous systems and decreases the parasympathetic nervous systems. This is, you know, the increase of sweating, blood pressure. You know, my blood pressure is kind of going up because I'm nervous. Impulse and decreases of digestion. So, you know, you're eating all this food, but you're having trouble, you know, your body's having trouble